Are you pregnant and you have pain between your legs? This is the video for you. Today we're going to talk about some of the reasons that you might have pain between your legs and what you can do about it moving forward. I see a lot of people talking about this that maybe don't have the credentials to talk about it, and they aren't mentioning all the things that it could be. So make sure that you're learning from an expert, someone like me. Hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I had symphysis pubis dysfunction with my last baby, but it was so long ago, everyone just ignored it. And I am grateful that more people are talking about it and we're getting more help for it. And I'm excited to give you this video so you can use the words you need when you talk with your provider. Okay, pain between your legs could be a variety of things. I know you've lived most of your whole life without pain between your legs, but during pregnancy, it is not unusual. So let's talk about some of the reasons you might have it. Caveat, when we're saying pain between your legs, it's really confusing because it could be pain in the birth canal area. It could be pain in your symphysis pubis. If you guys don't know where your symphysis pubis is, it's this little part. So this is all bone. This is your pelvis. Hopefully yours isn't crocheted, although it probably feels like it. And so all this white part is bone. And then this part is just cartilage. It's called your symphysis pubis, and it can stretch. During pregnancy, that's important because we need to get a baby out of here, right? However, less fun when you are like trying to live your life, right? And as a nurse, as I was trying to move these legs that come out from here, trying to push beds, oh my goodness, it just hurt so bad. So if that's where it's hurting, we're going to discuss it. But also you might just have pain in this whole area, all of your pelvic girdle. So those are the muscles involved in this area as well. And you may have pain in the different holes down there. So we're going to discuss all of it. I just want you to know there's a lot of different types of pain and a lot of reasons, even though most of us just describe it as pain between my legs, because who wants to get into the nitty-gritty of it, right? Me. I am the one. Okay, the first one is what I was talking about before, symphysis pubis dysfunction. So that's when this part just starts to separate a little more than usual. So as your body progresses into your pregnancy, it releases hormones. The main one's called relaxin, and it tells this part of your body, hey, let's chill out a little bit. Let's relax a little bit. And of course, that's to allow the baby to engage into the pelvis and hopefully come out when the time is right. However, it also does that to all your other muscles and ligaments, and this one can just become real loosey-goosey, and it can actually even separate. So we call that symphysis pubis dysfunction. Other people use other terms. A lot of times the term I hear here is lightning crotch. So you'll get what feels like a zap just north of your pee hole. And that is this sort of separating or jarring. It is more of like a nerve feeling because these two are coming apart and your nerves are like, what the heck's going on? But you can also have pain. One of the big indicators I always found with this one is if you have pain putting your pants on. So as you're lifting one leg, this joint really has to compensate for that. And then you lift the other leg, and that was just miserable for me. So a lot of times I would ask patients, hey, how does it feel to put your pants on? And if they were like, it's fine, then it's probably one of the other things. But if that is excruciatingly painful, you might have symphysis pubis dysfunction, and you definitely want to talk with somebody. There is physical therapy that can help you out, and we're going to talk more about how to get help from your provider if they're sort of brushing you off. So stay tuned. Okay, now you may have pain in your legs, in the groin area. It is not unusual during pregnancy to sort of pull a little groin muscle here as it gets in your body, mostly because you're compensating for how your pelvis is trying to react with a baby in it. And then you've got, this whole big belly over the top of it. So it's not unusual to pull a muscle in your groin area or to have inner thigh pain. That, of course, being different than symphysis pubis dysfunction, but also important to address. Now, you may just feel pressure in the birth canal. As baby starts to push pressure onto your pelvic girdle and sometimes dilate your cervix, it can be really painful in there. Or if your baby is breech, sometimes you have the magical feeling of baby kicking you in the cervix, which is not fun. So if your pain is in the birth canal, you'll want to talk with your provider about it. Just want to make sure that baby's in a safe position and that things are progressing okay, but definitely something to mention to your provider. A lot of people just talk about like a pelvic fullness, or the baby just feels real low, or they have to pee all the time. That can happen as well. Now, if you're having to pee all the time, that could be a bladder infection, and that can feel like pain between your legs as well. Sometimes your pee hole gets a little inflamed, or that whole area can burn. You could also have something like a vaginitis or something like that going on. So if it's more of a burning pain, definitely talk with your provider. They're going to want to check your urine, get a culture, and just see if antibiotics could help out with your situation as well. And that, by the way, is something I do not see mentioned on social media very often because the physical therapists like to focus on the other parts. Now, during pregnancy, you'll hear of something called ligament pain. So ligaments sort of flare out from the sides of your uterus and they attach all along both your abdomen and your pelvic wall. And these, as you can imagine, as the uterus starts to stretch, they start to stretch too, and they can get really uncomfortable. And that can be pain between your legs, pain in your hips, pain up here, pain along the sides of your belly. So that can be a problem as well. And yes, it feels like everywhere can be a problem during pregnancy as I am doing this. So what can you do about it? Great question. Again, if you're having the burning or things like that, you'll want to talk with your provider because that's something they might be able to directly be able to solve. Now, a lot of people come into the provider saying they have that electric feeling in their pelvis and the provider just goes, that's normal, and then moves on with their pregnancy checkup. You want to say, hey, that is actually really affecting my activities of daily living. That's a term that we use in the medical profession. You could use something else. Day to day, it's really affecting what I'm able to do, and I really want to get help for it. Providers never know if you want to know if something's just normal or if you want help for the situation. So it's really important that you let your provider know what you want out of this discussion. And if you want help to get it fixed, tell your provider that. Now, your obstetrician or midwife is not trained in body mobility. That's not what they're good at. They're good at delivering babies and keeping you healthy during your pregnancy. But they should have resources that can help you. A physical therapist, maybe even a chiropractor if your obstetrician's very open-minded. There are people out there that can help you. I know during my pregnancy, this part was really hurting and I just went about my day. I was still doing the stairs at work. I was still putting my pants on the same way. I was getting in and out of the car the same way. And it was really stretching this poor symphysis pubis. I had lightning crotch all of the time. Now, I actually went to physical therapy, but they really couldn't address this at all back in the day. Luckily, there are physical therapists that really know how to address it now. A few things that I've learned since then: why didn't I sit down on the bed to put my pants on instead of lifting these legs and putting so much pressure on this? I could have sat down and then my whole pelvis would have been a lot more supported. When I got out of the car, why didn't I turn my body to get out of the car instead of one leg and then the next one? I don't know, but it was making things worse. And there are things that we can just do during our day to make it a little bit better. One of the other things I wish somebody had mentioned to me is to wear a pelvic support brace. They go by many terms, belly band, but after I had my baby, this was still really hurting. And as I would go to work and I would wear our flimsy little scrubs that didn't give my pelvis any support, I was absolutely miserable, but still needed to work. So a friend of mine recommended a pelvic support brace, and it actually came down lower on the hips. When you wear a belly band, if it's just to support your belly, you're wearing it just below your belly. However, I wore a brace that helped support my hips to kind of shove this together until it was healed back together on its own. And that really helped. It might help during your pregnancy, so talk with your provider or a physical therapist. So those are my tips. I hope that you can get into a physical therapist. I'd heard a lot online that people are having a hard time getting into good pelvic floor physical therapy, but I hope you can find someone in your area. You may need to drive a little bit longer than you wish you could, but hopefully in just a few visits, you can change the way that you're moving your body to better support you. And I would have loved to have had a good pelvic floor physical therapist to have seen postpartum, because I think then it can be really helpful as well. Finally, is this normal? It is not unusual. Definitely a lot of people have this. I feel like the more times I got pregnant, the worse it got. So if you had it on your last pregnancy, you're very likely to have it on this upcoming pregnancy as well. But I hope you found this information helpful. Do you guys have pain between your legs? Which one do you think it is? Tell us in the comments. And I would love for you to give me a follow so that we can hang out for the rest of your pregnancy. And it really helps when you guys like this video because it tells YouTube it's high quality pregnancy content that can get pushed up to other people that need it as well.